castrated patient, meaning they have no testosterone. So if you treat a patient who has no testosterone and you take them from 0 testosterone to normal testosterone, so to take them from, let's say, 0 to 350, during that climb from 0 to 350, you can increase, theoretically, the risk of exacerbating a prostate cancer that's pre-existing, was the fear. But as you push past that level to optimal levels, you begin to insulate against the risk of multiple cancers. And all of the studies henceforth have shown there is not one single study that correlates testosterone therapy to prostate cancer. With an abundance of caution, some urology practices for patients who have had radical prostatectomies are reluctant to prescribe testosterone. But testosterone in no way, shape, or form is causing prostate cancer. It's a receptor site thing. So the best way to explain it is you can only water a plant so much, right? So once we've saturated the prostate receptor sites with hormones, they're saturated. And then when you push past that to an optimal threshold, you get the insulatory benefits of cancer reduction that testosterone appears to provide. And that's why the FDA is looking to change that label and get rid of the black box warnings on an array of different things that have been dogma around men and women's hormones.
So this initial study, like, why was the one person chemically castrated?
I don't know why. This is in the 30s, but since then, here's a really real-world example. With the boom in testosterone therapy, if there was an increased risk in prostate cancer due to hormones, you would have seen a skyrocket in the amount and prevalence of prostate cancer in all of these practices that are using hormone optimization. You don't. You see the same prevalence that we saw prior to hormone optimization and the boom. And so we have now seen, I think it's 1 out of 8 men will develop prostate cancer. I can't remember the exact number offhand. And that correlates exactly the same into the patient population that is on hormones.
Well, the reality is, like, everybody dies with some form of prostate cancer, right?
I don't know. I didn't know that.
Yeah. I've heard Huberman talk about that.
Interesting.
Yeah. Like, you have a certain amount of it. It's just like...
It really became dogma. I mean, the study
But I don't understand about the study. Like, so what was the conclusion of the study?
The conclusion of the study was if we treat men with testosterone, we'll see a rise in the precursor hormone that we were worried could correlate to increasing the risk of prostate cancer.
And was this only prevalent in this one person that was chemically castrated, or was it in the other guy?
Correct. The other guy who had normal testosterone levels had no increased risk. And you have to push through the threshold. So think you're at